Hello, it's Dr. Garrett Pullman, host of the Prostate Health Podcast. Receiving the diagnosis of prostate cancer can be very distressing for men and their loved ones. Where do you go from here? What are your options? Well, the good news is we have urologic oncologist Dr. Simon Kim joining us here today on the Prostate Health Podcast to help walk you through the process. The show today is brought to you by our sponsor, the Prostate Health Academy. The Academy is an essential community for individuals wanting to learn more about prostate conditions, connect with like-minded individuals, and improve their overall health. We just granted early Academy access to those on our waitlist this last weekend. Well, in case you missed the opportunity, for our loyal listeners of the podcast, we've also decided to grant early access to our podcast listeners before our big launch. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Again, that is www.prostatehealthacademy.com and click on Join Now. We will see you on the inside. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. One of our more popular episodes was episode 7 with Dr. Simon Kim. Well, today, we'll be bringing this interview out of the vault. Dr. Kim is a board-certified urologic oncologist at the University of Colorado Anschutz Medical Campus. He has worn many hats, including Director of Robotic Surgery, and his clinical practice focuses on the surgical management of prostate, bladder, kidney, testis, adrenal, and penile cancer. He has been independently funded from the NIH to develop decision aids for men diagnosed with localized prostate cancer. He has published more than 180 manuscripts and serves as the assistant editor for the Journal of Urology. Dr. Kim, welcome again to the Prostate Health Podcast.
Dr. Pullman, thank you so much for having me. It's really an honor to be here.
Dr. Kim, as you're well aware, receiving the diagnosis of prostate cancer can be quite distressing for that individual. Mm-hmm. I thought it would be very helpful for our listeners today to really walk them through a bit in terms of what it all means and what are some of the available options for them. But before we get into that, can you tell our listeners what it means to be a urologic oncologist? Now, how is that different from a general urologist, and what is involved with becoming a urologic oncologist?
Thanks so much, Dr. Pullman. That's a great question. Urologic oncology, typically we're fellowship trained and we do fellowships. And my practice is pretty dedicated to the management of GU cancers, prostate, kidney, bladder, and testicular cancer. That said, though, I would say that for prostate cancer, a lot of general urologists do that well as in practice. And I think it's just really critical finding a surgeon who manages that disease process and does it in a high volume manner. So I think that's a key important factor.
So Dr. Kim, when given a patient the initial diagnosis of prostate cancer, is this something that for you is delivered by a phone call, or do you have a routine scheduled meeting after the biopsy, regardless if it's benign or cancer, to go over these biopsy results?
I typically do that in person. I think that's a conversation you want to have directly with the patient and their family. I think receiving a cancer diagnosis can be somewhat challenging and difficult news to take. So, more often than not, I'll do that in person and ask actually the patient to bring his family members to the conversation and the visit.
Yeah, certainly. And I know in some rural settings that might not be feasible for some patients, and some of it might be patient-driven too in terms of their preferences and how they want that information delivered.
And I completely agree with that. I often will talk to patients at the time of the biopsy if they have a preference. And you're absolutely right. Some patients do want to have that phone conversation about the sort of, is it positive or negative? And then, often they'll say, well, if it's positive, I'll come in and visit. So that makes, I've done that as well.
So when having a patient come in for their prostate cancer consultation, kind of what recommendations do you have for them, in preparation? I think you mentioned, having them bring a friend to the visit or anything else that in preparation, do they need to, kind of think about?
So I think, prostate cancer treatments are very complex. I mean, unlike the other cancers you and I manage, it's really important that we engage in shared decision-making for patients. And I'll often ask them to bring their spouse and their family members to the visit. In addition, I think there are a lot of great resources that patients can look at online to get informed about prostate cancer, the treatment options, and sort of the trade-offs about different treatments and quality of life implications. So I think, having them as prepared as possible with their family members and their loved ones is really crucial to have an effective visit so you can make a treatment decision that's really aligned with the patient's values.
One of the first things I typically review with my patients is their pathology report. With the Gleason Score, there are two numbers. The first number listed is the primary pattern, and the second number, the secondary pattern. Adding those two up gives you the total Gleason Score, 6 being the lowest and 10 the highest. Now, can you tell our listeners a bit about what information we receive from this, particularly in terms of risk stratification?
Yeah, so I typically will review the pathology report, in particular about the Gleason Score. I think the Gleason Score is really predictive and associated about how aggressive the prostate cancer is or isn't. And I think that's a really key critical point. We've been typically doing, low risk, intermediate risk, and high risk prostate cancer based on the Gleason Score. And typically 3+3 is low risk, 3+4 or 4+3 is intermediate risk, and 8, 9, 10 is considered high risk. I think there has been a shift to grading of grade 1 being 3+3, grade 2 being 3+4, grade 3 being 4+3, and grade 4 4+4 or an 8, and 9, 10 is grade 5. And I think that's really important for patients to understand that grading system so they can understand, is this an aggressive cancer that warrants treatment, or is it potentially a low-risk cancer that may be better served by active surveillance? I also think the number of cores are really relevant to that conversation. A Gleason 3+3 in only one core, you could argue, is different from a Gleason 3+3 in 10 cores. So I think the grade or the Gleason Score as well as the volume is really important in that conversation. I think another part we talk about is the PSA. I think that really helps risk stratify patients into those risk groups that I had mentioned before. And so I think those are the two key things I really sort of gather from the pathology report in terms of formulating a treatment decision.
With there being several guidelines out there in terms of counseling patients, is there any particular guideline that you tend to gravitate towards?
I think the guidelines, by and large, are pretty uniform. There are some subtle differences in terms of the guidelines, in particular about active surveillance for 3+4 prostate cancer. What I will say is I typically rely on the American Urologic Association or the AUA or the NCCN guidelines in terms of formulating treatment decisions and risk stratification. I think they're pretty evidence-based and, are pretty balanced. And so those are the ones that I typically rely on.
Certainly. Now, I think, the trend used to be that, once a patient got that diagnosis of prostate cancer, every one of those patients would go ahead and get a CT scan, a bone scan at the time of diagnosis. But now I think we're seeing that we're becoming more selective in determining, who does and doesn't need these tests. What criteria, again, do you like to use in determining who does and doesn't need additional imaging at the time of diagnosis?
I think it's a great question, Dr. Pullman. I think in one regards for patients with, high-risk disease, I typically do get an MRI or a CT scan and a bone scan. There is a, small percentage of patients with metastatic disease. I think that's really important to have that conversation, have the information in formulating, a well-informed treatment decision for a patient. For low risk and favorable intermediate risk, I typically don't get scans, but for unfavorable intermediate risk, I will get a bone scan occasionally if they have high volume 4+3 prostate cancer. I'm sure as in your practice, I often will get an MRI if patients elect for surgery. I think that's really important for surgical planning. Biopsies and PSAs are accurate to some degree, as well as digital rectal exams, but I find that the MRI can really sometimes differentiate potential cancers that invade the capsule or the nerve. And so having that information for patients who elect for surgery, I think is really important so we can counsel them about, can we safely do a nerve spare if they have high volume 3+4 prostate cancer and you're a little bit concerned about potentially the cancer invading the nerve and going through the capsule.
Well, we're going to take a quick break with a word from our sponsor, and we'll be right back. Prostate Health Academy is an essential community for individuals wanting to dive in even deeper and learn more about the latest technology and treatments available to them for prostate conditions. In the Academy, you'll be able to interact with like-minded individuals in the private community forum and have access to exclusive bonus podcast member-only video content with experts, innovators, and leaders in the field. We'll also be keeping up with the latest evidence on prostate healthy diet and activity and creating a roadmap to keep you on track. We just granted early Academy access to those on our waitlist this last weekend. Well, in case you missed the opportunity, for our loyal listeners of the podcast, we've decided to also grant early access to our podcast listeners before our big launch. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Again, that is www.prostatehealthacademy.com and click on Join Now. We'll see you on the inside. Now, before we get into some of the various treatment options, you'd mentioned that a lot of patients will do some research before they get to that cancer consultation and be looking online. Are there any kind of resources that you'll typically direct them to in terms of websites or ones to kind of stay away from? Because I know that can get a little bit patients there's a lot of quote unquote fake news out there for prostate cancer. So do you kind of have a trusted go-to source that you like to send patients to do a little bit more research if that's what they're wanting to do?
Yeah, Dr. Pullman, I think that's bring up a great point. I think for prostate cancer in particular, there are a lot of websites that will contain information that isn't accurate or maybe advancing an agenda other than patient care. I typically rely on the American Cancer Society or the AUA websites. I think they have very balanced, evidence-based information for patients. There's also a website called Knowing Your Options that was developed by Robert Volk by MD Anderson. It's truly a decision aid that isn't designed to push one treatment or the other. It's designed really to talk about the options, the risk and benefits, and then, highlight the different sort of treatments and intensity of care that are associated with each treatment. So I think those are the websites I often rely on and work the best.
Now, could you give us a brief rundown of the typical discussion you have with your patients regarding their treatment options in relation to the various risk groups?
So I think for, when I have a patient who's diagnosed with localized prostate cancer, I think the first impression I typically talk to is that, prostate cancer, even with aggressive form, is still a slow growing cancer. And I really impress upon the patients that this is a type of decision where we have some time to make an informed decision. I think the second part after that is then I sort of say, well, this is prostate cancer in general, but, for your specific cancer, and then I sort of talk about where they fall in the risk stratification. Are they low risk, unfavorable, intermediate, or high risk prostate cancer? And then from there, if they're, say, high risk prostate cancer, we'll rely on the guidelines to talk about the treatments that are available per the guidelines. So, for example, for high risk disease, we'll talk about surgery and radiation with hormones, and then sort of talk about the subtle nuances about the benefits as well as the trade-offs for each of those treatments.
Certainly. So what are some of the big, the big risks that guys are concerned about? Or, I know both you and I know that, but just for our listeners, what are some of the biggest ones that come to mind in terms of when we're talking radiation, surgery, and that, may affect these men when they go through treatment? So,
yeah, I think Dr. Pullman, you and I both had a lot of these conversations with our patients. And I think it's a balance of, I have a cancer and what is my outcome? Will I survive this cancer? I think those are very important questions to address. Then I think, unlike other cancers you and I treat, prostate cancer treatment is a little bit different because there are quality of life implications like erectile function, urinary control, maybe some rectal toxicity from radiation therapy that are really important to address. And I think that having a patient fully informed about their cancer, their potential for cure, as well as the quality of life implications are really important. Because I think, treatment regret can be very difficult if they decide a treatment that they're not fully informed on or understand about the quality of life implications. So that's sort of the third part of that conversation is like, here are the treatment options, here are the benefits and here are the side effects. And then, from what we've described, which is sort of best for you, I think is really the way I kind of frame my conversation.
So there really isn't no one treatment fits all is what you're saying. And, we kind of look at, it's kind of that looking at that patient's preferences and, along with the risks and benefits and, what might be good for one patient, another patient might feel that they're a better fit for another treatment option. Would you kind of agree with that?
Yeah, I would completely agree with that. And I think, Dr. Pullman, you probably have often patients who say, well, what would you do? What is the best treatment? And I often will tell patients, I think the best treatment for you is what you think is best. Yeah. After we reviewed the treatments, the potential benefits and side effects, and then you feel fully informed, if you pick between the things we've talked about that are supported by the evidence, I think that's really an effective way for men to make decisions about prostate cancer therapy.
And I guess, nobody wants prostate cancer, but that is one thing that, I think with some cancers, it's almost like you're kind of on the clock, so to speak, from the time of diagnosis where, I think with prostate cancer, especially in those kind of low to intermediate risk for sure, these patients definitely have some time to really kind of, look at the options and along with all the risks and, to get, talk to various specialists, regarding different options. So, like I said, there's nothing nice about having prostate cancer, but they do have a little time to kind of really sort out what's going to be best for them.
Sure. Yeah.
Now, does your institution have some sort of a multidisciplinary prostate cancer clinic or options for patients to meet with multiple specialists, or do you kind of facilitate those referrals, to go see a radiation oncologist and so forth?
So we're actually just initiating our multidisciplinary clinic for all GU cancers, including prostate cancer. I think, one potential benefit for patients is that they can come to this multidisciplinary clinic and, see the surgeon, the radiation oncologist, and the medical oncologist need be in one setting. Alternatively, however, though, we just started this process maybe about 2 months ago. Prior to this, patients would come see us with diagnoses of prostate cancers, or for men we biopsied. And we would have, I think, a very balanced conversation about the risk and benefits. And then really, offer patients a radiation oncology referral if they would like one. Some patients want to do that. Some patients don't. I think you and I both probably give very fair and balanced conversations about the treatment options and the trade-offs. And I kind of, I think you and I would probably agree that, often these decisions about diagnosis and treatment are a patient-led process. And so if patients say, look, I really want to meet with a radiation oncologist, we're more than happy to facilitate that. Some men say, I heard everything you've said. I've done my research, and I really kind of want to proceed with surgery or want to proceed with active surveillance. And in that context, sometimes we won't offer radiation oncology if they don't want one. So it's sort of what I would say is a patient-led process for that.
Certainly. And, when we kind of look at some of the major guidelines like the NCCN, most of those guidelines, especially for the kind of intermediate to high risk prostate cancer, kind of focus on, prostatectomy and radiation therapy. But for some patients, they're seeking, other options. Do you have some patients asking about, HIFU or cryotherapy or targeted therapy as well for their prostate cancer?
We do have a lot of men who have looked at different forms of treatment like HIFU or sort of ablative therapies, as well as proton beam radiation, sort of, we would say are new technologies. I often will tell patients, we do have a specialist at our center who does do ablative therapies if they're interested in doing that. I do caution patients to some degree that the long-term data still isn't really present for those treatments. And, down the road, 5 years from now, if there's studies show that, those local therapies work really well, I think I'd be, much more supportive in that in the context of high quality evidence showing long-term benefit. But I think for certain cancers like maybe low-risk disease, if they want to meet someone who is interested in cryotherapy or HIFU, I'm more than happy to facilitate that.
Certainly. So a little bit off the topic, but Dr. Kim, now I understand you are awarded a Conquer Cancer Foundation grant. Can you tell us a little bit more about the Conquer Cancer Foundation? This sounds very interesting.
Yeah, thanks so much, Dr. Pullman. So I was very fortunate to be mentored by Dr. Carrie Gross at Yale when I was on faculty, and I received a Career Development Award from the Conquer Cancer Foundation, as well as ASCO, the American Society of Clinical Oncology. There's a 3-year Career Development Award really aimed at asking 2 questions. One was, I think we tended to overtreat some low-risk prostate cancers, and we didn't have really great data about, for younger men, what were the rates of active surveillance for low-risk disease? And then the second part of that question was, well, what are the barriers for men who had low-risk prostate cancer who probably or could be managed by active surveillance but received either surgery or radiation? And so that was really the goal of that grant. So I was very fortunate to receive it, and we published some really interesting results. But that was sort of the 2 questions we really wanted to drive at and get an answer to.
Yeah, well, that's outstanding. Congratulations.
Thank you. I appreciate it.
So, Dr. Kim, certainly a lot to think about for these patients as they're coming into their urologist to talk about all these different options. And we'll be getting into some of these different options, including, active surveillance, the different types of surgery, radiation therapy, even, targeted therapy. Any parting words of advice to our listeners out there in regards to, just being newly diagnosed with prostate cancer?
So I think what I would say for men who are diagnosed with localized prostate cancer is that, you're going to likely have a very good outcome. I think the key thing is to be fully informed about the treatment decision. understand all the treatment options available to you, as well as the risk and benefits. And then I think, it's really important that for our patients that, they're very thoughtful and, really choose a treatment that reflects their values and their preferences and their goals in life is more specifically. So, I think when patients do that, I think, that's a really good outcome. I think the difficult outcomes are when patients don't feel fully informed and there's a quality of life implication or don't understand the aggressiveness of their cancer and there's a different outcome that they're not aware of, where I think it can be very challenging for those patients.
So in summary, receiving the diagnosis of prostate cancer can be really quite distressing for an individual. Certainly nobody wants to be a part of this club, but with working closely with your urologist, you can gain the necessary details to begin determining which option will be best suited for you. Dr. Kim, we really appreciate you taking time to join us today on the Prostate Health Podcast. I think you've really given our listeners a lot of value today that can be used to help empower them regarding their prostate health. Thank you again.
Dr. Pullman, thank you so much for having me. It was really an honor and a pleasure.
Thank you again for listening to the Prostate Health Podcast. Follow me on Twitter and Instagram at gpullmanmd. Don't forget to join us next week for another episode.